Welcome to Podocyte Talk. In today's episode, we're highlighting 3 studies that explore new ways to protect kidney health across different stages and populations, ranging from patients with diabetic kidney disease to older individuals on dialysis, and even those with obesity, with or without diabetes. We begin with a landmark study exploring the combined use of Finerenone, a non-steroidal mineralocorticoid receptor antagonist, and Empagliflozin, an SGLT2 inhibitor, in patients with chronic kidney disease and type 2 diabetes. While both agents are individually known to offer renoprotective benefits, until now, there has been limited evidence on whether starting them together adds value or risk. This study sought to answer that. Researchers enrolled adults with chronic kidney disease, with a filtration rate between 30 and 90, albuminuria, significant protein loss in the urine, and type 2 diabetes, all of whom were already receiving a renin-angiotensin system inhibitor. Participants were randomized to receive Finerenone alone, Empagliflozin alone, or a combination of both. The primary endpoint was the relative change in the urinary albumin-to-creatinine ratio at 180 days. The results were promising. At baseline, urinary protein levels were similar across the 3 groups. By day 180, combination therapy reduced proteinuria by 29% more than Finerenone alone and 32% more than Empagliflozin alone, a clear signal of added efficacy. Importantly, there were no unexpected safety concerns. Low blood pressure, acute kidney injury, and high potassium levels were infrequent and rarely led to drug discontinuation. This study strongly suggests that starting Finerenone and Empagliflozin together could provide enhanced proteinuria reduction in patients with diabetic kidney disease, potentially delaying progression more effectively than either medication alone. It reinforces the idea that combining distinct complementary mechanisms may yield stronger renal protection. Next, we turn to a study focusing on a more vulnerable group: older adults with diabetes undergoing hemodialysis. As dialysis technology advances and the dialysis population ages, managing blood sugar becomes increasingly complex, especially with the risks of low blood sugar episodes. This study monitored older adults with diabetes on dialysis, using continuous glucose monitoring over several months. It revealed that low blood sugar episodes were significantly more common on dialysis days than on non-dialysis days, especially in the 2 hours following a dialysis session. Nearly 55% of participants had hypoglycaemia on dialysis days, compared to only 24% on non-dialysis days. The risk was especially high in those with early morning dialysis sessions, lower average blood sugar levels, and lower blood sugar at the start of dialysis. Interestingly, maintaining higher average glucose levels and beginning dialysis with a blood sugar above 8 millimoles per liter was associated with fewer hypoglycemia events. These findings underscore the importance of individualized blood sugar targets for older patients on dialysis, balancing the risks of high sugar with the serious consequences of low sugar. Tailoring care in this way could reduce complications and improve overall safety in the dialysis unit. Finally, we look at a post-hoc analysis of the SURMOUNT-1 and SURMOUNT-2 trials, which examined how Tirzepatide, a once-weekly injectable medication used for weight and diabetes management, impacts kidney parameters in people with obesity, with or without diabetes. In both trials, participants who received Tirzepatide had reductions in the amount of protein lost in the urine over 72 weeks. This effect was seen even in those without diabetes, and the reduction was particularly marked in people who started with higher levels of albuminuria. Importantly, the drug did not cause any harmful changes in kidney filtration rate. In fact, in the group without diabetes, Tirzepatide slightly improved kidney filtration estimates using some measurement methods. In the diabetes group, both tirzepatide and placebo showed slight increases in filtration over time, with no major differences between them. This suggests that tirzepatide may offer kidney protective effects through reducing albuminuria, even in people without diabetes, and does so without negatively impacting kidney function. These findings add to the growing evidence that this dual hormone receptor agonist could play a future role in preventing kidney damage in people with obesity, whether or not they have diabetes. Together, these three studies highlight how kidney care is expanding, from novel drug combinations that reduce proteinuria to recognizing and preventing hypoglycemia in dialysis settings and to exploring weight loss medications for their broader organ protective potential. As research evolves, the focus remains clear: personalize care, prevent progression, and protect kidney function. Stay tuned to Podocyte Talk as we continue to bring you the latest in kidney science and clinical innovation.